Okay, I want to welcome everybody to Mental Health Monday today. And we have, looks like kind of a small group. Want to apologize on behalf of Daryl Buttricks. He came down ill and was hoping to be able to participate, but he is not well enough. So we'll have Michael King and Paige LeForte as our guest presenters today. And just to get an idea of who's here in the audience, we'll introduce ourselves. I'm Lori Verdier. I'm a family member and an ally.
And I'm Candy Blakesley, and I'm doing the tech stuff behind the scenes, and I am a family member.
Memory?
Oh,
Yes, I'm a family member.
Thank you. And Ingrid?
I'm a family member as well.
Thank you. And Ralph?
Family member.
And Rose?
Family member.
And Kim?
Family member.
All right. So a lot of family members here today. With that said, our topic today is holiday stress, mental health impact, and support that we can get. As you know, we like to bring people in that have different perspectives on the topic, and Paige is going to be sharing perspective from the position of Clinical Director of Spectrum Healthcare and what it's like for an organization. What do they see overall during the holidays, and supports that they provide. And then Michael is going to bring a perspective from more the lens of a private practice, private practitioner, what he sees over this time of the year, and how that what supports are provided. And then after they both have their 10 or 15 minutes of discussion, we'll go into a full discussion where everyone can ask them questions, where we all interact and see where that goes. So first I want to introduce Paige. Paige is a clinical director of Spectrum Healthcare. She's a licensed clinical social worker and holds a master's degree in social work from Arizona State University. She spent her career working in community health centers, community mental health centers throughout the country, focusing on crisis intervention services and also as a mental health therapist. Currently, she oversees the mobile crisis team for Spectrum, their outpatient mental health services, and supervises several other programs with Spectrum Healthcare. And Spectrum Healthcare is the community behavioral health provider in Northern Arizona with offices, facilities in Cottonwood, Camp Verde, and Prescott Valley and Prescott. I don't think you've extended to Chino, and you're no longer in Sedona. Is that correct?
We provide services in all of Yavapai County. Our physical office locations are in Cottonwood, Camp Verde, and Prescott.
Okay. Well, thank you. And with that, go ahead, Paige, and we'll give you the floor.
Absolutely. I did want to clarify one thing. My experience is county-wide, not countrywide. I wish I would have left Arizona, but I'm born and raised here and I haven't left. This is my home community. And I think it's been a really big privilege working in it. You know, I definitely had some personal struggles that guided my career into this field, and I love helping my own community. And I also think this is a really important topic today. I think it can be a catchphrase that you can see on social media, you know, preventing holiday stress. What should you do? 10 things to do this Christmas to help keep yourself calm. And as great as those are, to me, they can feel a little campy. You know, I mean, you can have someone give you a list, but when you are in the trenches, or if you have a family member with mental illness, or you struggle with your own mental illness, those suggestions can feel frothy and not having a lot of substance to helping you get through what is these last couple months of the year. One of the things that we see through our mobile crisis team and our clinic as a whole is a dramatic increase in family conflict over the holidays. I think everyone can relate to that You have all these family members coming in that you maybe don't see on a regular basis. You're all sitting at the same table. Maybe you have different belief systems, and arguments can arise. And that seems to be the biggest precipitant that we see to individuals going into or experiencing a crisis, is those family conflicts. And so that's one of the topics that I would like to talk about today, is setting boundaries and maintaining healthy dynamics with your family during the holidays. And I think the other big thing that we see is the financial strains and the budget strains on individuals during the holidays. I can't tell you how many people I talk to that say, oh my gosh, with COVID, it's been so hard. Maybe they were laid off, maybe they can't find work. And how are they supposed to provide Christmas for their kids when they are focused on paying their mortgage or looking at different aspects like that? So those feel like really prominent topics for me and what we see. And that's kind of the direction that I wanted to head from my perspective of things. So looking at family conflict, I think that it can be really easy to, one, keep your distance throughout the year or set boundaries. You know, you're at work, you have a normal routine that you keep that kind of puts some of that distance between you and any conflict that you're struggling with your primary support group. But the holidays bring us all together in a much different fashion. And I think COVID has a really strong role to play in that these days, because there's a lot of conflicting beliefs around COVID, around vaccines. I've seen a lot of polarization in families over the last 18 months. Well, we're pushing 2 years now. Holy cow. And it's important to look at these things and to talk about setting boundaries. And I think one of the most important conversations we have with our clients is you don't have to go home. You don't have to be around people that are going to compromise your stability or your sense of self, or that are ultimately going to be a negative influence on your day-to-day well-being, and that it's okay to say no. You know, we all have those family members that we roll our eyes with when we have to go see them, and you don't have to do that. And setting boundaries and learning to say no and giving yourself grace to say no is a really important step throughout the holidays. There's not judgment to pass for doing what you need to do to stay okay and to not put yourselves in stressful situations. I was talking with my supervisor this morning, and she had a Thanksgiving where normally there's 12, 15, 20 people, and it's this huge family reunion. And this year it was just her and her husband in their PJs eating turkey and pumpkin pie. And she was talking about how amazing it was to just sit with her husband and enjoy the day and not have to cook a massive meal, and be able to stay in your PJs and relax and actually enjoy the time off from work if you're in a field where you get time off from work. And that's important. You know, it can be these big family gatherings if that's important to you, but it's also okay for it to be a small group and for it to be much more casual and relaxed. We're in an era where social media and the internet portray a very high standard that we feel like we all have to meet. You know, if you don't have a beautiful table and a 25-pound turkey, then, oh my gosh, how are you celebrating? And getting down to the root of just taking time for yourself and your family is the most important part of the holidays, and finding that meaning that isn't in the commercialization of it. We also look at the time frame for a lot of these incidents, or for when crises occur. There's a really big conversation that the holidays are when suicide rates spike. And although danger to self or suicidal thoughts do come up a lot during the holidays, it's usually the day or two after where we see things kind of fall apart. So everyone can hold it together Christmas Day or Thanksgiving Day and eat with their family and enjoy the day. And then the next day, there is that just emotional hangover and that crash. You've put everything so tightly wound and in a pretty box to get through that day that the crash happens a few days after. So if you have an individual or a loved one in your life that struggles with mental illness, from our perspective, the most important days to check in with them are the days after the big holiday, because that's when we see the biggest uptick in decompensation. And so coming up with a plan with your loved one and saying, hey, you know, let's check in this day, let's go have lunch 2 days later, or why don't you call me when you can, and looking at those measures where you can provide support following the big family event. The other thing that I mentioned talking about is budgeting. I think the holidays, it is very easy to slip into overspending and give it, you know, I need to buy every single Christmas gift known to man, and I need to have the biggest spread at Thanksgiving that I possibly can, or it won't be good enough. And those internalized messages definitely lead to a increase in shame, because we're sitting there telling ourselves that if I don't have money, it is not good enough. It is not okay. If my kid doesn't have 25 presents under the tree, it's not okay. And we need to move away from that narrative. COVID has taught us all a lot in how we have to get creative in budgeting. If you got laid off, if you couldn't find work, with the eviction protection that went away over the summer, that's been a really big stress for people, is housing. The holidays don't have to be extravagant, and teaching and working with individuals on how to keep the holidays special and within your budget are really important, because come January, what we see is all this financial strain that they couldn't pay their mortgage on January 1st, or that with all the Christmas lights up, their electric bill was triple what it normally is the month of December. And that comes, creeping around the corner in January. And that's when we see a huge pressure of financial strain. And it's important to talk about, I think especially with our family members or with social norms that we've created, it's very easy to say we don't talk about money, but that's a very important conversation to have and to be open about. You don't want to put yourself in a negative situation for the monetary value of what the holidays mean to you. And one of the ways we look at that is, what can you do in lieu of spending money, or how can we divert the way we are spending the holidays? And one of the biggest things we talk about is through experiences. Giving your time as the gift, giving your activity as the gift. And with some of these restrictions lifting, and with COVID slowly allowing us to navigate the world again, we're finally able to get back to that. I mean, last Christmas, it was such an intense lockdown, and it was so hard to get out and do anything. The movies were barely open. They were only showing reruns maybe twice a day. You couldn't go to the mall. You couldn't go on a hike. Some of the national parks even closed. I mean, it was just a tremendous barrier to self-care, losing everything that people go out and do to take care of themselves. And we're finally in a place where we're slowly being able to do all those activities again. And that can be really important and meaningful to your family and to yourself. You want to look at ways that you can influence the holidays that create memories, or that build up your sense of self-care. We do get time off work if you're in that kind of a field where you're, don't have to work during the holidays. And we get to fill those with time and activities that should fill us up and not drain us.
Thank you, Paige. Next, we'll move on to Michael, and let me say a few words about Michael first. He's the medical director at Red Rock Family Services here in Cottonwood. He's a licensed professional counselor and holds a master's degree in counseling and a bachelor's degree in youth and human service administration. His counseling experiences have included working with children, adolescents, and adults in coping with a variety of relationship problems, mental health, and substance use disorders. Michael has extensive experience working with children, adolescents, and adults. And this cut off. So, Michael, if I've left anything out, I'll let you add to that.
The first correction, I'm not the medical director. I think you have to have a medical background for that. I'm the clinical director. And yeah, I think a lot of what we see is kind of similar to what Paige is seeing over at Spectrum. Our specialization is not in, mental, I guess, as far as seriously mentally ill individuals, but we deal a lot with general mental health and, of course, substance abuse issues, things like that. I think all of us, historically have had, I think increased amounts of stress during the holidays, and a lot of it's like self-induced kind of stuff. But then COVID comes along and really puts a challenge to all of that. That being said, I don't think I've had anybody come in specifically to say that they're there because of COVID, that their stress or their anxiety or their depression is related to COVID. I think it's more about, COVID is kind of the, at least one of the symptoms of why they're there. Many times, I've had people come in because they've lost someone because of COVID. because I do work with a lot of adolescents. Often it's, they've lost a grandparent or they've lost a parent because of this, virus. And of course, I don't think, in general, the mass majority are paranoid about getting COVID or any other virus like that. But I think there's a lot of concern that they would actually get it and pass it on to somebody that's more vulnerable, and that, they would lose a loved one or something of that nature. So, so there's that sense of concern about, being around aging parents, those kind of things when, you feel healthy, but yet you don't really know if you are or not. And especially, because my specialization in the last few years has been with adolescents. I've had probably 100 kids I've worked with that have had COVID and didn't know they had it. And so then they end up, bringing it home, and their parents get it, and it's not such an easy situation, for them. So the things that I think are causing people more distress, particularly related to COVID, has been, a loss of income, sometimes a loss of their business. I've had some young kids that I've worked with that very athletic and looking at, possible career, at least, scholarship to get into college based on their athleticism. But because of a lot of the sports teams had stopped playing, they've lost some opportunity. Okay. And I think a lot of business owners as well have lost opportunity because of it. So, I know that when we opened Red Rock, we had got licensed. It was around March 1st, 2020. And it was like 2 days after that, we had all these COVID shutdowns. So we were sitting there holding a business and with an office lease and employee salaries and those kind of things, and, no income. And so we kind of had to dip into some resources just to kind of, keep us going. And so other businesses would not have been able to navigate. I have a adolescent program that I oversee in Colorado Springs, and then we also have Red Rock and in the Verde Valley, and so I go back and forth a lot. And I can tell, the way that the shutdowns have happened and everything else, Colorado took a more stringent approach than Arizona did. And so the outcome is different in each of those states. And I think in each community. So if I drive across the reservations, particularly the Navajo, you can see that there's just so many businesses and families that have just been overwhelmed. Okay, not only because of the virus, but because of the shutdown of the virus. So, so the effects, I think, have been pretty strong. We've seen a lot more substance abuse problems, and people that were in recovery that were really dependent upon those meetings and the face-to-face interactions and those hugs that they get, all those kind of things. And because of COVID, a lot of that stuff went by the wayside. Of course, we all tried to do virtual meetings. Maybe helped a little bit, but ultimately it wasn't keeping people clean and sober the way that the direct meetings were. I don't think that we have a realization yet of how the family violence has actually escalated during this pandemic. My experience, I've been a family violence specialist since the 1990s. And I think a lot of these people, they, of course, money is one of the main things that families argue about in the first place. And when we take away their funding, then we're going to have a greater problem. Spending too much time together. When we look at, abuse survivors, often, it's the good times are the times when the abuser wasn't home. Well, nowadays, the abuser is home a lot more often. And so I think there's a lot of things that we're not really seeing. And a lot of the cases, that would have normally been processed through the court quickly, were held up. And so now we're kind of seeing some of those things come through, but it's been a slow trickle. So I think, we talked about some coping strategies, and Paige had some great ideas, and I appreciate the fact she didn't use a canned response. So that's cool. I think it kind of depends on the person and what you're capable of doing. I always say, hey, get outdoors, go have some fun. To me, the outdoors is probably like the most healing place out there. But if you can't go outside, then that could be a problem. Okay. Some people don't really have the opportunity to do that. I do think that, having some kind of an exercise plan really helps to relieve stress. Sunshine definitely helps to relieve, I think, a lot of stress and pressure. But having a social life, when you can't really be face to face to people, that kind of puts a damper on things. I don't think that social media is the answer to that, but we do have Zoom, we have FaceTime, we have all kinds of other things if people have the internet capability to do that. Okay. But being able to stay connected to people, I think, really helps quite a bit. Our attitude towards things helps a lot. So if we can try to maintain kind of an attitude of gratitude, trying to maintain that positive viewpoint, which in my opinion, probably one of the only ways to do that is to turn down the social media, turn down the news. Sometimes we have to step away from that stuff altogether. They make their money on scaring the crap out of people, and probably not the most healthy thing for us to do. So we want to stay informed, but we don't want to be overwhelmed. And then, of course, just having that sense of alone time, I think, can be good for most people. A place where you can go where it's quiet, and even if it's just for a few minutes, that can be really hard when you have a large family, and other dynamics going on, but I think it can be very helpful. And probably one of the most practical things is being realistic in our expectations of ourselves and our expectations of others. And of course, that would include being able to set boundaries, being able to set priorities, that you wake up in the morning and you put your list together and you go for that one thing. And after you finish that one thing, if you want to do another thing, that's cool. But not allow ourselves to get too overwhelmed. And that, I think probably one of the keys to that, not getting overwhelmed is, just kind of being able to prioritize our life, and to look at ourselves in a realistic kind of a perspective, and not compare ourselves to that person that's just like incredibly productive from the very start of their day. So that's kind of in a nutshell. I mean, I think, Paige mentioned about the budgeting thing, and I think that's part of that priority thing, that you're not going to be able to do it all. And no matter what you do, it will never be enough anyway. So that's okay. It's okay. Just relax, have fun, try to remember that, the reason for the holidays is to enjoy it, to have a good time. And I think sometimes to do that, you have to kind of back off on the expectations. So that's about all that I had on that right now. Okay.
All right, thank you, Paige and Michael. At this point, we're going to open it up to everybody that is on the call. If you have any questions or comments for either Michael or Paige, or anything on the topic, we'd love to hear from you.
I'm going to start. I usually don't, but I'm gonna start because I had a holiday situation come up this year. I have a wonderful Christmas village that never gets put up. It did when I worked because my coworkers wanted it, so we put it in the office. But I've been retired now for 3 years, and every year when Christmas comes around, I think I need to put that village up. I need to put it up. You know, I gotta find the spot. It has to go up. It just has to go up. And so this year I was bound and determined to put up that Christmas village. And when my husband got the boxes out, I went, oh my gosh, we got rid of tables. Now I either have a table for a tree or I have a table for a Christmas village. What could we put the tree on? We ran all over. We were looking for the perfect thing to put the tree on, so we could put up the village. And I actually was in a really bad mood. Instead of the joy of putting this up, I was in a bad mood. And my husband actually left the room. And he's a very calm man, but he left the room. And I sat down and I thought about it. And I thought about Barbara Luttrell, who was very prominent in the Mental Health Coalition Verde Valley, which this program is one of their programs that we've assumed. And she said to me just about 2 months before she passed away, when we were talking about my china, she said, do you use it? And I said, no. And she said, why do you have it? Why do you have something that you're not using and you think about that you should be using? And I thought about Barbara and I thought about the village and I packed it up and I put it in the back of my truck and I took it down to the domestic violence thrift store. And they were delighted to get this. And I had more joy in giving it away. And now I never have to think about that stupid village. I loved it, but I still don't have to think about it and the guilt of putting it up. And so that was my way this year of holiday, of relieving some of my stress on that Christmas village. And the tree is up on that table, but the decorations aren't on it yet, but maybe this afternoon. So we just kind of just relaxed and said, you know what, we don't have to do it all.
Yeah.
That's great. And that brings up another thing, that if we look at lists of what helps manage stress, giving things away, sharing with others is definitely on that list.
I have to tell you too, that China is at the domestic violence thrift store too.
Yeah.
So we tried to sell at the garage sale. Nobody wants China, but I gave that away as well. And I think we've done that a lot this year, given many things away that we just don't use anymore.
Well, I think it's possible that the more people that we add to our life, the more animals that we add to our life, and the more things that we add, the more stress that comes along with it. And so there's that management thing that you don't allow all this stuff to interfere with your emotional well-being.
Agreed. If you look at it, what is it that we really need?
Yeah.
I thought about this as I've been decluttering.
Yeah.
Also, the fact that I look at something and I go, gosh, I really needed this when I bought this. I really had to get all the pieces to that village. I really had to do all that. And now, later in life, it's just not as important as it was when I was younger.
Yeah.
Absolutely. And what an important thing to say. Just because something held meaning at one point in time doesn't mean it has to continue to hold meaning forever.
Right.
And I think that's something that can stress people out. I mean, well, every Christmas morning we've done this tradition for 4 generations and I hate it and it makes me feel guilty, but my mom demands it. And it's okay to stop. It's okay to stop and create new traditions or donate the Christmas village. We're doing something really similar at my house right now. I'm just done. I'm like, we're putting it all in the car and we're going. I can't do it anymore. And, you know, our external environment is a really good reflection of our internal state. And if you have this external object that just symbolizes guilt and frustration with yourself and shows all of these things that aren't making you feel good, get rid of it. get rid of it, release that burden, release that shame, and move forward and do what makes you happy, which is the little tree. And maybe we'll get decorations on it in a week. If not, it's a nice tree.
Yeah, that is so true. What Candy said and Paige, I find it very liberating to declutter and even organize all the junk you still have. So it's really a good idea to do that. You feel so much better. I had relatives over the Thanksgiving holiday here, and I did give them both, they were women, I gave them both some jewelry that I've had sitting around. I've never worn it. And I thought, why am I holding on to all this? So I was on the same wavelength as Candy.
The other thing that I might want to bring up, we talked about before the audience came in about my Thanksgiving. I have a son with a serious mental illness, and he agreed that Thanksgiving would be at 1:30, and I think at 1:25 he said, he messaged me, he doesn't talk on the phone, he messaged me and said, I just woke up, I'm getting ready. But dinner was ready at 1:30, and he probably finally showed up about 2. We went and picked him up about 2, and he was here approximately 10 minutes before he said, I said, you look grumpy, or you're looking at me angrily or something. And he said, I'm ready to go home. And we took him home. And I wrote him later and said, next time when lunch is at 1:30, we'll just eat at 1:30. And if you come at 3, that's okay. There'll still be food, that we won't have the expectation that you're actually going to show up on time. And when you're dealing with someone with a serious mental illness, which when we introduced ourselves, many of us do have family members, I think it's important to know that the thing, like you're saying, Paige, dinner's going to be at this time, it's going to be in this way and whatnot. It's not as necessary. We can just do what we want, and they can either participate or not participate.
Absolutely. The whole thing around expectations and being realistic and keeping up with change. I read something recently that had to do with those who survive well with things aren't necessarily the strongest or the most intelligent. They're the ones who can adapt.
Yep. And
adapting to the changes that we're experiencing this holiday season, the second year with COVID impacting people in so many ways, dividing some families over vaccine or anti-vax, people socially isolating and that sort of thing. There's a way of adapting and, continuing to have social engagement, continuing to connect, even if you can't do it physically in the same room. These are ways that people have really found using the adaptation skills. So who else has something to share or comment on this?
Lori, it's Mary. Can you hear me?
Yes, Mary, we can hear you.
Hi, Lori. Yeah, it's Mary Wins, and I guess I just want to put in a plug here for working with clients, and especially during this time. Some of our clients are trying to make up for lost time, and we can never, ever, ever do that. And I really try to stress that it's now, and you can they want to buy the biggest present for their kids that they haven't been around for, the time they've been in prison or incarcerated or out running around, doing drugs or whatever. The best present they could give would be their full self. And I really try to stress that. It's easy for us to say that as professionals. Hopefully we get that. But, to convince some of my clients, a lot of my clients right now, this was their first sober Thanksgiving. I have a couple clients, it was their first Thanksgiving out of prison for 10 years. Can you imagine that? It's just like, how do we fathom all that? And then you want to make up for lost time. So, but my point is, it's just, I'm trying, try to teach it simple, keep it simple, and I want to keep it simple. And so a lot of times, well, the last few holidays for Christmas, my family, we don't even get presents for each other. We give them to the tree, maybe for the angel care, who presents for elderly or whoever it is. But anyway, I think it's easy for us to say stuff, but for our clients, it's a lot more challenging, I think, because there's such competition out there. Does that make sense?
Yeah, I think you bring up such a strong point about gifting and the gift of time, the gift of self, the gift of thoughtfulness is not a material, the gift from the heart, the thoughtfulness, and with the expectations due to commercialism and our society and our culture, this is something that we like to combat, to come back down to the realistic, what can I afford and where's the meaning in it, and really the gift of time with those who work full-time, having to budget their time with others, and finding the time to connect and be giving just that gift of self is so important. And homemade gifts. I know that, a lot of service providers will maybe do a group with arts and crafts and say, here's what we have, make anything you want for anybody. And I was thinking one of my most treasured gifts is a Christmas tree ornament that my daughter made when she was probably 7 years old. And it's just coloring on paper of an ornament. And I thought, I'm going to get that thing laminated because I don't want it to tear apart. And she's 36 years old now. So yeah, there's some sentimentality around that. But one of the most valuable gifts I have from her is this little paper ornament for a tree.
I was going to mention, and I think, Michael, you mentioned this too, getting together on Zoom. My sisters and I, one lives here and one lives in California, one lives in Virginia. And we weren't ever together for holidays, but we started on birthdays having a Zoom meeting, gathering, and it has really been fun. And I know a lot of people do that and did that last year. They would eat a meal together. They're all in their own homes, but they're on Zoom. And Zoom, you can do 40 minutes for free. You can get an account and it's free. And then you can meet with other people if you have a cell phone or if you have a laptop with a camera. It's pretty easy to do. And so that's another way of being with family and or friends or a chosen family without having to physically be together, especially at this now with another variant apparently we're going to have. Who else has some suggestions that have worked for you?
Well, let me ask you, as we're waiting for someone else to come forward with things that have helped you combat holiday stress, because I tend to think that everyone on this call has experienced holiday stress in one way, shape, or form. Just listening to the idea of letting go of a tradition that now is not something that is fondly embraced, but is more stressfully, oh my gosh, I have to do this, I'm really not enjoying it. Has anybody else, does this ring a bell for anybody else? Is there something that you're thinking, gosh, maybe just because we've always done it that way, that if there's no joy in it, why continue it? Okay.
I have a similar thought, and it's almost the opposite. What we see a lot, or what I've encountered a lot, is things that were highly, highly valuable and meaningful that are just no longer feasible, and that causing a lot of upset. Like every Christmas Day morning, we made biscuits and gravy with my mom, and now my mom doesn't want to do that anymore. And finding acceptance that things you once loved are no longer feasible. Candy, I think this may fall into what you were talking about with Thanksgiving. Maybe at one point it was really important to eat together at 1:30, and that's no longer feasible, and finding acceptance and adaptation in new normals.
Thank you. And Michael, your mouth was moving, but I think you
I
were on
know,
mute.
I had muted it for a minute. No, I had one family I was working with that they had decided that they needed to break from tradition because it just wasn't working for them, particularly with the money they were spending and all this, emotional stuff attached to it. And they decided as a family, and they had smaller children. I think the youngest was like 6. And they decided that instead of doing a Christmas thing for the family, that they actually decided to do something for the community. And so they had kind of adopted another family, and they just had so much fun, just trying to find ways that they could help meet this other family's needs and give them, a few gifts and prepare a meal for them, all those things. And it turned out to be like their most memorable Christmas ever. And they didn't spend any money on themselves, but they spent it on others. And so that's a total break from their tradition, which is hard to do, but in their case, it worked really well for them.
That's beautiful. Thank you for sharing that. And Ralph, you had your hand up a minute ago.
Yeah, I was just going to share something from Thanksgiving. So in our family, we have a small granddaughter here, just about 3 years old, in Arizona. And because she has 3 sets of grandparents, Thanksgiving is scheduled. So our Thanksgiving was on Saturday. But the first Thanksgiving was our daughter-in-law's sister hosted Thanksgiving. And then on Friday, there was a kind of a cookie baking project day centered on one of the houses. And I happened to talk to the sister of our daughter-in-law, Nikki, about the stress of holding Thanksgiving for everyone, or at least that side of the family that day. And she was just stressed out over what had happened, and expressed the thought that maybe next year her and Adam would just go somewhere on holiday and avoid Thanksgiving. That kind of a level of stress that, they're willing to go to Hawaii and get away from it all and not be part of it next year, that kind of a thing. It varies greatly. I can relate to the differences in the fact that I am on my 3rd wife, and so I've had the experience of different families over the years, and how different it is with regard to the pressure on gift giving and what the meals are like and who is required to do what. And I find that whole subject of being required to do what is sort of like, I'm getting too old for that.
Thanks, Ralph. It's something that what Michael said about the family giving to other family reminded me of something that I see in my community. I live in Hornville, which is a rural community. And when my daughter was in grade school, a couple of the women of families in Hornville came together and called it the Hornville Women's Group. And they have an auction the first weekend on Saturday or Sunday, the 1st of December every year. And items are donated. And they find a place to hold the auction. It's usually it was in one of the private homes. They just took all the furniture out, put chairs in, and so all the items are donated. And every year it's gotten bigger and bigger, and they expanded to now I think they do this at the Hornville school, at any rate. All of the money goes to gifts for kids, and they have the school provide them with the names of of kids that are in low income, underprivileged situations. And they will buy gifts for family members of how many different families, it's not kids' names, but families. And it's just a really beautiful thing that every year happens. And there's any kind of items. There are a lot of quilters. So there are a lot of people that donate quilts. And at this event, they raise a lot of money, and depending on how much money, it's how many families and how much per family, but every year this has become a really good tradition of community members giving back to the community and helping those in need.
I've done, when we lived in Phoenix, I did the Christmas Angel several years. And I remember taking all the gifts to the table because I thought the child needed pajamas. They needed a Christmas outfit. They needed toys. They needed this and needed that. And the person behind the counter that took my items said, "This is for one child." And I thought, oh, they're not going to give it to one child. They're going to spread it out, which rightfully so. But it's a delightful thing to be able to do that and think of a child opening things on Christmas morning.
Memory, you go ahead and unmute.
Oh, there's a family tradition that lowers stress with my sister and her family. So at Christmas, instead of going out shopping and finding all these expensive things, she basically wraps all the grocery items under $1. And we open boxes of crackers and cans of chicken, things that we love to eat. And it's totally stress-free. The fun is guessing what's in the box.
And another way of giving is if you are a consumer and you're out there at Starbucks, you buy the coffee for the person behind you or whatever they're getting. I've seen postings on that sort of event. It's just, you know, the feel-good part of the holidays where really it is about giving and sharing. And I think that another thing that we need to really be aware of is the isolation and connecting to people that are isolated and being in touch. Anybody else?
And that reminded me one year when my son worked, he worked at Waffle House and he was married at the time. And they both, that's mandatory, they work on Christmas. So we got up Christmas morning and went and had breakfast at Waffle House in Phoenix. And we did that. We bought anonymously people who were sitting at the counter alone. We bought them breakfast. And that was really, really quite fun too.
Yeah.
Yeah. That's meaning, you know, meaning that we don't normally think about when we're all focused on that Christmas village.
And another thing we can look at is our homeless population. You know, I'm always reluctant to give anybody money because I'm concerned that they're going to spend it on substances. But, you know, you can carry food. And, you know, one time I gave somebody an apple and then I thought, oh gosh, I wonder if they have teeth, because I wasn't, you know, thinking it through. And some of those folks, an apple would not be something that they could use. But I know I have a friend who will take a Ziploc bag and keep at least one or two in her car, and it's got toothpaste and a toothbrush, a washcloth, and soap in it, and hand that to people that are homeless on the street corner asking for help. Just another way that we can help out in our own communities. Anybody else that we haven't heard from want to make a comment on anything?
Or have a question that you're thinking about that you would like to see if anybody has any ideas of a solution for you.
So I'll put a question out there. I'm wondering, you know, with the holiday season, we have two people here on the call that are providers, and that would be Paige and Michael. Do you have any extra groups or a different kind of resource, or any resource that you'd like to mention that might be of help for someone to share with another or for themselves.
We have various groups, particularly for like depression, anxiety, those kind of things. Actually just started a women's domestic violence group as well, both for primarily for the victims. And then and we have some adolescent programs that are coming up for kids with experiencing substance abuse related issues. And so we're trying to keep a kind of a pulse on what is needed in the community. So the one thing I wanted to add to the conversation, we have all these ideas, which I think are good to help relieve or at least deal with, stress, anxiety. Some of our interventions are going to work well for some of us, and it may actually be more anxiety producing for others. So like I mentioned, going outside, I think exercise is very good for stress management. But for some people, that could be extremely stressful. And so sometimes we have to take people by the hand a little bit and kind of introduce them to new ideas. And then other times we have to just simply work within that person's framework as far as what's going to be, best for them. And so when it gets to family, it's even more tricky because, I would love to just go to a ski area for Christmas and just forget everything, but that would just blow my wife's brain up. There's no way that she could do that. And so, we have to make accommodation for our families and for those people around us. But at the same time, I think that we can reach some compromises that will help us to kind of deal with our day-to-day life stress. So.
Absolutely. And I think as far as our programming is concerned, we don't change anything for the holidays. We remain consistent in our services because sometimes consistency matters a lot in maintaining routine when work schedules or family schedules change up day to day, but also just making sure everyone is aware that there are 24/7 services available in this community. And that is through the Spectrum Crisis Team, through the Crisis Stabilization Unit in Prescott Valley. There are several different agencies that all make themselves available regardless of holiday closures. And I think people forget that. They'll try to hold on thinking, oh, they're closed for Christmas or oh, they're closed for New Year's. And no, we don't stop. We're 24/7. We want to make sure that services are always available.
There are also national and local crisis lines and warm lines. I think a lot of people don't know about warm lines. Warm lines are like a hotline, but you can call and ask anything. You don't have to have a crisis. If you just need someone to talk to, if you just want, actually the teen warm line actually helps with homework. And you can find those crisis lines many places, and we also have them posted on the mental health resource.org site for you as well. And NAMI nationally has a line, and they have a text line as well. Yeah, Ralph?
Yeah, a question for Paige. You were talking about the crisis response network that you are part of with your job. And in what you just said, you were talking about a crisis stabilization unit. So my question is, it has nothing to do with today, but it has to do with the future. Are you familiar with Dr. Balfour down in Tucson and their crisis stabilization unit?
Not particularly, no.
Okay.
It's my understanding every REBA has a crisis stabilization unit, and a REBA is a regional behavioral health authority in Arizona. Because we record this could be anywhere. And so every area does have one. So that would be true in Tucson.
Well, yeah, but Tucson has been held up several times in NAMI webinars as an example for the country in terms of the three basic parts: how you reach them, how the crisis response team works, the stabilization unit, the no wrong door principle, et cetera. So many people on this call are familiar with the fact that 988 is coming next July?
So I'll jump in really quick, Ralph. I just want to clarify things. So we are not Crisis Response Network. That is now called Solari, and that is a suicide prevention hotline. That's not associated with Spectrum. So we run a mobile crisis team. And then 988, the way that is functioning is it is the National Suicide Prevention Hotline is being replaced by 988. And so it's just a simpler number to call, and it will still go to a suicide prevention hotline. So it's just a less numbers to call than anything else, and that is rolling out in 2022.
Yeah, you're talking to, preaching to the choir here. NAMI had 3 days of this over the past couple of weeks, 3 days of webinar on the 988 coming. What I find is that I was with a group of business people at lunch here a week or so ago, and I asked if anybody knew what it was, and there was nobody in the room. I'm in the White Mountains, rural America, way beyond Yavapai County, rural. But it is something that is going to have to be prepared for, and it's not just money out of Washington. It's setting up and running these kinds of crisis stabilization units. Our service, their Change Point has they've got a toe in the water, but they're not running a complete, no wrong door and getting you detoxed and getting you prepared for reentry into society, et cetera. They're a long ways from that, but I wish we could get some of the knowledge and expertise from places like Yavapai and down in Tucson and easily transplant it, but it's not going to be that easy. I can tell that already. I'm sorry, I went off program, ladies.
That's okay, because you know what I just wrote down, Ralph, is that's the topic for future Mental Health Monday, is talking about crisis and maybe getting the crisis stabilization units in several counties, in several REBAs to speak about what it's like. I will say, unfortunately, I had the experience with the Spectrum mobile crisis unit for my neighbor who attempted suicide. And I have never actually been with a crisis team before. And the young man who came out, who was from the crisis team and was helping the family while the first responders were doing what they needed to do, was absolutely amazing. And my thought of a crisis team is that they come out with the police and they they go on, and it would be negative. And this was in a very negative situation. This was very positive, and has reinforced that I would call a crisis team. In the past, I never would, but I would. And I think, unfortunately, the holidays might be time that we have to do that, but what a positive experience. And I actually know someone on the crisis team too, and what a wonderful dedicated man he is as well.
Yeah, the entire concept it's going to be wonderful once it's implemented, but it's going to take a lot of work to do that. I mean, I remember back in 2013, after my son's first suicide attempt, calling, 911, and of course the EMT showed up with the police, et cetera. And the people from CRN were not very helpful, frankly, in that situation. And but that's not a knock on public safety or CRN. It's that it's focused around public safety, 911, and it's still going to be focused around public safety, and their job is going to become a lot easier and less complicated when there's another number to call for a different situation, which is behavioral health crisis. That's going to become a lot better. Now, it's like getting the cars in the right channel to drive on a highway. Right. It will, but it's the indications from the webinars is it took, I think, 2 decades to get 911 to operate. I hope it doesn't take 2 decades to get 988 to operate.
No, I think it goes live in July, if I'm not
It does.
mistaken.
Yeah, but that's just the number, Candy. That's just the number. That doesn't mean that everybody is prepared to do all of the things that
Right.
Dr. Balfour describes in Tucson. And she's not in charge of it. She's just a professional in the mental health field that has given presentations several times that I've sat in on some of NAMI's webinars nationally.
Yeah.
Anyway, we're off subject. Sorry.
Yeah, no, but it's a good subject, and I'm sure we'll be visiting that again in the future. And it does leave room for organizations to provide education to those they serve around it.
Well, we're hoping that your holidays don't have crises. Right? We're hoping that they're smooth and that, you know, and that you've pared down your expectations, as I continually have to do.
Yeah, I just want to say that I think we've had a lot of wonderful tips on managing stress and preventing crisis, but understanding that if it does occur, to know what to do and to go ahead with that. But I think that Michael and Paige have given us a real good list of things to be able to do for ourselves and those that we care about through the season.
Okay, well, I'd like to thank Michael and Paige for coming today and presenting. I think we got a lot of good information, and for everybody in attendance, we appreciate you coming.